Welcome. This video is a super short overview about massage therapy and what to expect from a treatment with me. Massage therapy works with the muscles and the soft tissues of the body, helping to promote circulation and relaxation. Communication is key throughout the treatment. We're going to talk about the very thorough health history form that I get you to fill out so that we're able to customize a treatment plan that's optimal for your healing and where you're at on your journey. Throughout the session and after, you're going to want to gauge everything by a good workout kind of pain, so that constructive discomfort, making sure that it's not a sharp pain, that your body's not resisting the work that's being done, because that will change the approach that I have to treat that area. You're going to want to make sure that you stay focused on your breath throughout the treatment. So inhale through the nose and exhale through the mouth, or nose if needed, depending on your comfort, depending on what position you're at on the table. The treatment is completely customizable to meet your needs and support you in whatever we're working through that day. So maybe you need a pillow under your hips. Maybe you need the face cradle adjusted. It can be lowered, it can be angled, it can be lifted up. There's tons of options. There's some cloths on it for cushion to help cushion the line that it makes on your face and help support the cheekbones so that you don't feel as much pressure. So know that all of that can be adjusted, and just let me know if we do need to. And the bolster's there to support under your ankles when you're laying on your stomach and under your knees when you're laying on your back, to help support the natural curvature of your spine, easing pressure in that lower back. And if you're having a lot of lower back discomfort and you need a pillow under your hips or a blanket, that option is there too. Just again, make sure that you keep that line of communication open with us so that we can treat you as best as possible. Table warmer can be adjusted, room heater and fan and window. So if temperature needs to be adjusted, that's an option too. You will be completely covered throughout the entire massage. So what you wear is completely up to you. Completely naked, underwear on, completely clothed, whatever one you choose, we're good with that. The only difference is if an area has clothes on it versus the ability to work directly on the skin, it will just change whether or not we're able to do techniques that glide or more of that compression technique. Both are effective, it will just be a different sensation for you. Same goes for glutes, work on the buttocks area. If you prefer to keep your underwear on, or if your underwear covers your glutes, we're still able to work on that area. We'll just do over the sheet so that we don't leave the underwear covered in gel. We will keep all areas covered unless we're working on that area. So for the back, for example, tucking it into underwear or shorts if you're wearing any, or just under your hips if you're not. So just being mindful of any gel transfer through the sheet there or onto your clothes when we're done the massage treatment and you get up to get dressed. We'll talk about everything when you first come in for the treatment, and then I'll step out of the room, let you get ready, and then come back in. The lights of the room are on an app on my phone, so don't panic when I start to adjust them before I'm back into the room. And then I use essential oils as well. So there is one diffusing and one on the armrest. Unless you prefer no scents, then just let me know and I'll make sure that there are none when you come in. And you can choose in the form that gets sent out to you before your session. You can choose if you have a preference for oil that day. I do have a variety in stock always. So if I have it, awesome. If not, then I'll pick the next best thing that's within that section of oils. And then the pressure and the technique can be adjusted depending on what you need. So my style uses the medium pressure, but I'm able to use more or less depending on your preference. I will work into the deeper layers regardless to make sure that we are having an effective treatment. Again, you want to make sure that you're not resisting any part of the treatment, because if you are, it's going to be more of a workout for you and we won't be getting the relief that we need. So just really breathe into it and let me know if anything needs to be adjusted, or if it's that sharp kind of pain, or if it goes beyond that constructive discomfort and it's now a destructive pain that you are really feeling guarded about. After the appointment and before, you're going to want to make sure that you prep and take care of yourself after. So making sure that you have ate and drank appropriately for that day so that you're hydrated, but of course being mindful that you might be on the table for 30 minutes to 2 hours to 2.5 hours. So just honoring that time. If you do need to use the washroom partway through the session, that option's there. So don't ever feel the need to hold in a bathroom break, because that's, again, not going to serve your treatment best, and different areas will be tensing up trying to guard and restrict that. So do let us know. We'll just step out, let you run to the washroom quick. It's just across the hall. And make sure that you don't eat a big meal right before you come in. If you're not experiencing digestive challenges, then it might not faze you, but you want to make sure that your body's able to process all of the work that we do, because a massage is like a workout. You're just not the one doing it for that session. So just making sure that your body has the space to allow that energy to be allotted for the treatment and not focused on digesting. Again, if you're not having digestive challenges, you might not feel phased at all by it, but just be mindful of that. And then after the session too, you're going to want to make sure that you drink extra water. This is important so that you stay hydrated and so that your body has extra, so it can flush out whatever it might need to that day. You're going to want to make sure you fuel your body too, because just like after a good workout, your body has a lot of shifts happening and a lot that it needs to care for. So just making sure that it's adequately fueled to be able to do that and to be able to truly heal is very important. There is a tablet in the room as well, connected to YouTube. So you're welcome to play anything that is relaxing for you, whether that's music, whether that's a podcast, whether that's an audio book, whatever it might be, you're welcome to play it. If you have something on your device that you prefer to play, there is a Bluetooth speaker that we can connect your device to. So there are options there. And if we're ever playing something that you're not a fan of, or if we ever pick a playlist and then you change your mind, just let me know. It's YouTube, super quick, easy to change partway through the treatment. So that is not a big deal at all. And throughout the session, it's important again to keep that communication open, making any adjustments to the table, to the positioning, to the pressure, to the temperature as needed. You'll always have that top sheet on unless you prefer to wear shorts in your treatment and not use it, but your gluteal cleft, so your butt crack and your triangle in the front, your genitalia region, that will always be covered throughout a treatment, always. So wearing shorts or we'll drape the sheet to make sure that stays covered. Everything else on the body can be worked on, so head to toes. Feet, front and back of your legs, buttocks region, your back, your neck, your face, your scalp, your eyelids to hands, your abdominal area, all of that can be worked on, and whatever you're not comfortable with can be excluded in the treatment too. So that could be a full body massage, or it could be targeted work depending on what's bothering you the most that day. Whenever you come in, we'll talk about it all. So your first session will be more in depth because it will be our first overview of the health history form and really assessing where you're at and what your goals are for healing. After that first session, the conversations will be shorter. So we'll just talk about how you felt after your last session, how everything's feeling now, if anything's changed, anything new, what our goals are that day, and then we'll talk about the treatment plan so that you know before you get on the table what our game plan is, and then if we need to tweak anything and adjust depending on what we're working on, what we find throughout the session, we'll have that conversation too before we change anything, so you always know what's coming next and what to expect. If you're ticklish, don't worry, that's something I've worked with a ton, and that's definitely something that we can work beyond. So just let me know if there's any areas that you're a bit more ticklish or sensitive, and we'll be able to honor that, respect that, and help you and that area feel safe throughout the treatment. There are towels too, so an extra hot towel in the warmer, and above the warmer if you're wanting to wipe off any of the extra gel after your massage. I do like to use Japanese mint oil in a massage too, so just like any menthol you might have applied, it has that tingly and warm and then cool like ice feeling for a while after. It's used to promote circulation and relaxation. I love it the most because I feel personally that it gets deeper than any other topical ointment that I've used, and it smells amazing, especially if you have any sinus congestion. But know that if you aren't feeling well, it is best and highly recommended to cancel your massage, no fee, if you're not feeling well, because a massage is a lot for your body. We don't want to aggravate those symptoms or move anything around that shouldn't be moved around. So let me know, text or phone call, or if it's beyond the 24 hours, you'll be able to cancel that online. Do not come in if you're not feeling well. But if you aren't feeling well and you've got a Japanese mint bottle at home and you have your sinuses congested, that scent will help alleviate that. So the areas that we use that Japanese mint oil is usually on the back and feet with a hot towel after to help promote circulation and relaxation. The hot towel basically just feels good and helps remove some of that extra gel. So if there's a different area that you'd prefer, a different area that might be bothering you more, let me know and we can use that Japanese mint oil there instead of one of the other areas, so you're not covered in it when you go, because that could be a little bit chilly and a little bit intense. And then if there's any other tools that we're called to use in your session, whether you want to try myofascial cupping or kinesio taping, whatever it might be, it's something that we can talk about and tailor to what you need that day. So that's a little overview of massage, what to expect when you come in. And when you leave the session, you want to make sure that everything again is gauged by that constructive discomfort, that good workout kind of sore. So you might feel sore after a treatment, you might feel energized, you might feel tired. If you are feeling a sore, it shouldn't last beyond 3 days, and it should not affect your day-to-day activities. If it goes beyond that 3-day mark and it's distracting you throughout the day, inhibiting you from doing your daily activities, then let me know. We'll adjust the time that we spend on that area and the techniques used to help avoid that in the future, because we don't want it to be that sore. We want you to feel, okay, yes, things are shifting and I feel better, but not for it to distract you or inhibit your day-to-day activities. So that's a little overview of massage, what to expect when you come in for your treatment. So thank you for watching, and I look forward to treating you soon.